Good morning. Welcome to part 2 of nursing practice questions and answers about risk conditions related to pregnancy. Now let's start with the first question. The nurse is performing an assessment on a pregnant client in the last trimester with the diagnosis of preeclampsia. The nurse reviews the assessment findings and determines that which finding is most closely associated with the complication of this diagnosis. So these are the options. Option A, enlargement of the breast. Option B, complaints of feeling hot when the room is cool. Option C, periods of fetal movement followed by quiet periods. Option D, evidence of bleeding such as in the gums. Now for this question, the correct answer is option D, evidence of bleeding such as in the gums. Now let's move to the rationale. Severe preeclampsia can trigger disseminated intravascular coagulation because of the widespread damage to vascular integrity. Bleeding is an early sign of disseminated intravascular coagulation and needs to be reported to the primary healthcare provider if noted on assessment. Finally, options A, B, and C are normal occurrence in the last trimester of pregnancy. Now let's move to the second question. The nurse in a maternity unit is reviewing the client's records. Which clients would the nurse identify as being at the most risk for developing disseminated intravascular coagulation? So select all that apply. So these are the options. Option A, a primigravida with abruptio placentae. Option B, a gravida 2 who has just been diagnosed with dead fetus syndrome. Option C, a gravida 4 who delivered 8 hours ago and has lost 500 ml of blood. Option D, a primigravida at 29 weeks of gestation who was recently diagnosed with gestational hypertension. Now for this question, the correct answer is options A, a primigravida with abruptio placentae. Option B, a gravida 2 who has just been diagnosed with dead fetus syndrome. And option D, a primigravida at 29 weeks of gestation who was recently diagnosed with gestational hypertension. Now let's move to the rationale. In a pregnant client, disseminated intravascular coagulation is a condition in which the clotting cascade is activated, resulting in the formation of clots in the microcirculation. Predisposing conditions include abruptio placentae, amniotic fluid embolism, gestational hypertension, HELLP syndrome, intrauterine fetal death, liver disease, sepsis, severe postpartum hemorrhage, and blood loss. Now, in my presentation, my reference book have used Saunders Comprehensive Review for the NCLEX RN examination 9th edition.